heard that the worst ever COVID variant, the Omicron, is now in Africa? Do you know now that it's found in over 6 countries and it's spreading like wildfire across the length and breadth of the world right now as of November 2021? In today's video, I'm not here to scare us about another episode of COVID-19 because we've seen the Delta variant, we've seen so many variants, but this particular variant, it still needs to be learned about it. So today on this episode of Nursing with Abby, I'm going to have to give us a little information about what we have, the knowledge we have about this Omicron variant of COVID and what we can do to ensure or prevent that it doesn't spread. Hello everyone, you're welcome to another episode of Nursing with Abby. I hope today's meets you well. Now today I'm going to be talking about the worst COVID variant already seen in Africa called Omicron. But before we go into the topic of the day, I'd like to thank all of my subscribers. Thank you so much for the love and support. I really appreciate you. Thank you so much. I went on a long break and now I'm back. Now if you're watching me for the first time, you're welcome to Nursing with Abby. On this channel I talk about nursing, I talk about lifestyle, and I talk about everything in between. Now, my name is Nurse Abiodun. I'm a nurse, I'm a midwife, I'm a public health advocate, and I love what I do. Now, like I said before, I'm going to be giving you a brief information as to the updates on what we know about this variant of COVID called Omicron. And I got so many informations which is quite recent, and you could check also on the World Health Organization website, the Center for Disease Control's website, and you could also check on the CNN network also for so many informations about this also to update yourself. But these are the little information I got, that the Omicron variant is called B11529. That's the name of the variant. Like we have Delta variant, so we have Omicron variant now. And it was first reported in South Africa by a South African doctor on the 24th of November 2021. Now, the specimen that led to this discovery was taken on the 9th of November 2021. So this is quite recent. Now, we all know that the previous episode or variant of COVID has given birth to so many, we call it mutations. Mutations are just like a father giving birth to a child that doesn't look like it. That's just what mutation means. Yes, a father giving birth a father giving birth to a mother giving birth to a child that doesn't look like it. So definitely whatever is being used for the father cannot be used for the son. That's what the variant means. It's going to be something extremely different from what we know. So this particular variant was detected, like I said, in South Africa, and it's been a variant of concern. That's the name that the WHO called it, a variant of concern. So concern means that we still yet to know a lot about it, but we have already seen a lot of people already infected with it, and it's spreading like wildfire. Now, it's been detected in the United Kingdom because it's not only in South Africa. United Kingdom by the BBC, the South Africa already by WHO, also in Germany, in Israel, in Czech Republic and Hong Kong. Now, in fact, we had from the 2 days ago, there was a report that we had 7 people who were infected already in Israel, and they are under strict surveillance and isolation. Now, it's important that we know that though it's still at the early stages of its detection, it's important that we know that these mutations may make vaccines less effective. Yes, because a lot of people believed initially that when you take your vaccine completely, you're completely immune against COVID-19. Yes, we could have that as what we knew before, but with these variants coming up and the various mutations that it's going to hold on with, it's possible that the vaccine taken already might be less effective towards this. In fact, the South African doctor who made this particular discovery, is a practicing South African doctor called Dr. Angelique Kotesi. She chairs South African Medical Association, and she sounded the alarm about this Omicron vaccine, saying that the symptoms are unusual, but they are mild in healthy patients. But she's worried that the strains could cause complication in the elderly and the unvaccinated. I'll take that again. She said that the symptoms are mild in healthy patients, but she's worried that the strand of this particular type of COVID, which is called Omicron, could cause complication in the elderly and the unvaccinated. So it's important for us to make sure that we're vaccinated, at least with what we have right now, which could give us a form of protection. Now, she also said that those she treated having the variant neither lost their sense of smell or taste as we know that those people that have COVID will lose their sense of taste, smell or taste. But these ones didn't. They just had extreme fatigue. And that's what concerns are, that if a healthy adult with this type of variant is extremely fatigued this way, how much more someone who is unvaccinated or already have a compromised immune system. She also said that the vaccine could affect the efficacy of the vaccines that are being taken. That this variant could affect the efficacy of the vaccines being taken. Now, CNN described this Omicron variant, I mean, as more transmissible because it's like spreading very fast, and then we really do not know where exactly it's gone to, but they've been seeing cases or traces of this particular variant all around the world. And because the borders are open and all that, so there are quite a number of countries that are trying to ban travel or flights coming in from such countries, especially South Africa, that they've noticed that this particular variant is. For example, Mauritius has also stopped flights from South Africa from November 28th. In fact, in the Punch newspapers in Nigeria, 28th of November, the virologist has given an advice to federal government to ban travels from South Africa, and to the nation also said that they are going to start clamping down on civil servants that are not yet vaccinated. They didn't give the exact date, but they've started modalities towards that to ensure that at least all civil servants are vaccinated. Now, it's important for us to know, I'll have to sound a note of warning here that this is not to scare us, because I know the kind of scare that COVID-19 gave to us in 2020, but it's just to get us prepared, it's just to get us in the preventive mode to ensure that this variant does not affect us the way COVID-19 did. Now, it's important for us to ensure that this particular virus still affects the immunity or immune system of a lot of people. So we should ensure that we try as much as possible to still improve as immunity. One. Number two, all the safety guidelines or COVID protocols, we still try to ensure that they are kept. Social distancing, putting on a well-fitting face masks, hand hygiene, providing ventilation in indoor spaces, preventing crowded spaces, getting vaccinated. It's also important to ensure that as this yellow side season is coming, we try to restrict crowds, a lot of people coming together for events or gathering, because that is really where this type of virus can transmit more easily than everybody staying at home and all that. So it's important for us to have an idea of what is going on. It's an international news right now. It's not something new, though a lot of people have not started talking about it, but it's important that we start talking about it early enough and we start to prevent ourselves from whichever way we can. With all these procedures, social distancing, hand hygiene, wearing of masks, are still things that we can do within a little sphere of influence, than for it to have come into the country and we are not trying to treat, we are trying to manage, we are trying to do for oxygen, we are trying to prevent deaths and all that. It's better to prevent the illness than to start treating when it's already a pandemic, or it's already been spread across the whole environment. So my people, everyone, Nigeria, Europe, Germany, everyone, let's come together. Let's ensure that we nip this in the bud. We were able to manage COVID-19 with teamwork, yes, from all over the world, all the virologists all over the world. Be able to work together to ensure that COVID-19 didn't sweep the whole up of the old generation. So this would never be an exception. We would all try to make sure that all hands are on deck to ensure this. That it's important for government all over the world to ensure that they restrict flights to countries or from countries that have this particular variant, and then if need be, ensure that isolation procedures are being taken to ensure anyone coming in from such countries are quarantined, they're contained in a place for a while before we ensure that they're fine. Okay, so that's all I have for you. Please, in case you have any questions, any queries, any comments, you can drop them in the comment section. You can go also to the website, CDC website. You can go to CNN. You can also go to World Health Organization to get more information about this. It's actually trending news right now, and that's why I'm dropping it hot right here. So thank you so much for another episode of Nothing with Abby. Till I see you in my next episode, please stay safe. Please ensure that you practice social distancing. Ensure that you avoid crowds, and make sure that if you're sick, you stay at home. Thank you so much for another episode. See you in my next episode. Bye for now.